Good afternoon, everyone. All protocols observed. I'd like to welcome you back to JEI Week 2024. We have reached at our final seminar, and it is my esteemed pleasure to introduce Professor Joseph Sadek, who joins us from Dalhousie University. He will be leading us on a presentation this afternoon on continuing mental wellness. So I now would like to hand over to Dr. Sadek. Please note that the program, which includes his full bio, will be shared with you in the chat. So good afternoon, everyone, and let's look forward to this exciting presentation on continuing mental wellness. Good afternoon, Dr. Sadek.
Hello.
Yes, we can hear you now.
Can you hear me okay?
Yes, I can hear you okay now.
Okay, thank you.
We can't see you,
Okay.
Dr. Sadek. Yes, that's better. Now we can hear you and we can see you.
Great.
Great. Right, so I'll now like to hand over again to Dr. Sadek. So good afternoon, doctor.
Okay. Thank you. Hi, everyone. Today I am going to talk about a mental well-being and wellness. Before I start, this is my objectives. I am hoping to describe some factors that would affect one's well-being, identify skills to optimize use of time, list some specific strategies that promote well-being. My disclosure, I wrote 5 books. This is my disclosure statement, my books. And I want to start by describing well-being. We have a organizational well-being where the system and the resources are well. We have individual well-being, which I am focusing on today. And there's also relational well-being between, us and our colleagues and our family and friends. And so why mental health is important for overall health? This is a very important question. For many reasons. It helps us have a healthy relationship with others, work productively, realize our full potential, cope with stress. There's so many other ways. But it's also important to note that mental illness, such as depression, increase risk of other types of physical health, like heart disease. We know for sure that so many studies showed that there is a higher risk for heart attacks, heart disease, stroke, diabetes with mental illness, particularly depression. It's also important because it's highly prevalent. 1 in 5, this was 20 years ago, 1 in 5. Now I think it's the incidence is much higher than 1 in 5. So probably we're talking about at least 10% now, sometimes more. Now, it's also important legally that the ability of the court to fulfill their mission, perform their function, is based on public trust and confidence in legal system. And this trust and the confidence is based on us doing our job, performing the duties, adhering to ethical standards. So if the legal system fails to pay attention to their well-being, that would mean that their duties would be altered. I can't do my job properly. And this would also impact the public trust and confidence in the judiciary. This whole publication, you could find it at the United Nations website. So I wrote an article there, and you are welcome to visit it at yondoc.org. So now, the any questions so far, or any comments so far? I'm happy to make this interactive. Would you have anyone has any questions or comments at this point? Um, can you all hear me okay?
Yes, we can, Doctor.
Okay, thank you. So what are the common mental health problems that could impact us? And it's important for us to understand. The first problem is burnout and stress. This is very common in the legal system, lawyers, judges, very common, doctors. So prolonged response to chronic stressor on the job, we have three categories that happens. The first one, feeling exhausted. So I feel so tired. The second category is called detachment. I am detached from my family, my friends. I am very detached. And the third category is called sense of ineffectiveness and lack of accomplishment. Despite I'm so accomplished, I am always feeling that I have done nothing. I'm worthless. I'm not successful at work. This is bad. I hear that all the time. As a matter of fact, I had a very prominent lawyer in my office yesterday who exactly told me this. And then I said, "So how many hours a week do you work?" And it was very difficult. But he is just basically completely burnt out. The effects of stress cause cognitive symptoms. So you have memory problems, you can't focus, mood and anxiety symptoms, some physical symptoms, procrastination, neglecting other responsibility. We could revert to alcohol or smoking or drugs, or then risk of cardiovascular disease. There is a burnout inventory here, and you could rate it between 1 disagree and 5 completely agree. If you have more than 2 of these that are, if you score more than 10, you are at a high risk of burnout. I can't focus at work as I used to. I'm overwhelmed with the amount of work I have to finish. I'm neglecting my family and friends. My sleep has deteriorated. I don't sleep well. I don't feel valued and appreciated as I used to be. I'm gradually losing my motivation to improve the process at work. My ability to contribute and give has been declining. So, first problem has been a burnout and stress. Very, very common. The burnout has three categories again: exhaustion, detachment, and sense of ineffectiveness and lack of accomplishment. When I'm exhausted, I can't function. I'm detached. My family can feel it that I am no longer available to them. I'm there, but I'm not actually there. Since I feel like I'm not doing anything at work despite I'm working really hard. Second problem is an adjustment disorder, when we are having a certain stressor and within 3 months of that stressor, I have a more distress than what I expect and I can't function. So this is a simple issue. It could happen with low mood and anxiety, both anxiety and depression, disturbance of conduct. I start yelling and screaming, and mixed disturbance of emotional conduct. So I feel depressed and I start throwing things or unspecified. This is called adjustment disorder. The third disorder I want to talk about is called generalized anxiety disorder. Since COVID, this is becoming the most common disorder that we see all the time. Okay. The generalized anxiety disorder, you have to have worry in different areas for more than 6 months, and you cannot control your anxiety. You also need 3 out of 6 symptoms: muscle tension, poor concentration, irritability, lack of energy and fatigue, restlessness, and sleep problems. I can't tell you how frequent and how prevalent this disorder. So I talk to people, they tell me, well, we worry about everything. We cannot stop worrying. We have all of these symptoms. So I feel my neck muscles are tense, my back muscles are tense. I can't concentrate at work. I am irritable. I snap at my receptionists or secretaries, and I have no energy. I'm tired all the time. I'm always fidgeting or restless, and I can't sleep at night. You don't need the 6 symptoms, you only need 3 out of the 6. So this would be the generalized anxiety disorder. Now, the new category I want to talk to you about is called PTSD, which is post-traumatic stress disorder. And with the legal system working with a lot of hearing about trauma or defending trauma or judiciary exposed to trauma, there is a risk of PTSD in this group. So you could have exposure to an actual or threatened death or serious injury, sexual violence, in one or more of the following ways: directly, or learning that traumatic events happen to a close family member or close friend, or I think you fall into number 3, experiencing repeated or extreme exposure to aversive details of traumatic events. For example, first responders of collecting human remains, police officer exposed to details of a child abuse, uh, people working in hearing, during the court, details of horrific crimes or killing or murders. That would qualify for PTSD, post-traumatic stress disorder. Now, what are the symptoms? So you have to have one of the intrusion symptoms, you have to have avoidance symptoms, and you have negative alteration in cognition and mood. So intrusion symptoms, which basically you get dreams, you get flashbacks of the event, and avoidance symptoms is basically you try to avoid the memories if you know any external reminder of that you try to avoid. The negative alteration in cognition, you need to, you can't remember some aspects of the event. You have persistent and negative belief about yourself, saying, well, I'm bad, no one can be trusted. Persistent negative emotional state, like always in a feel of guilt or anger or horror. Anhedonia, not enjoying anything anymore. Feeling of detachment from others. Inability to experience positive emotions, happiness, satisfaction. And then finally, there is arousal state. So you can't really sleep, you have anger outbursts, you are hypervigilant. So those are the categories of PTSD. Now, the next category is depression. Do you have any questions on this category? We talked about burnout and stress, talked about adjustment disorders, talked about an generalized anxiety disorder, and then we talked about post-traumatic stress disorder. Any questions so far? would be actually helpful if we tackle this as we go. So if you have any questions or comments, and feel free to turn on your camera and ask any questions. No questions? Should I continue on? Yes, no, maybe?
Yes, please.
Yes, please.
Okay. The next category would be depression. Depression is also highly prevalent, and you have to have either low mood or loss of interest and pleasure. So you don't enjoy things anymore. You feel low. Changes in appetite or sleep, either increase appetite, increase sleep, or decrease sleep and decrease appetite. Guilt, hopelessness, poor concentration, low energy, and feel that suicidal thoughts. So it starts with I I I feel like people would be better off without me, then I actually would like not to be here, and then start making plans of, jumping off the bridge or shooting myself or things like that. So this is the problem with depression, is having these kind of suicidal thoughts. Depression, when it's severe, it could come with what we call psychotic symptoms. Psychotic symptoms like hearing a voice. So you start hearing a voice telling you to go shoot yourself or kill yourself, seeing something or believing, having a delusion, which is a fixed belief about something that's not true. So you could believe that, uh, there are cameras monitoring you, or people are poisoning you, or things like that. So that is the next level. So depression is really important. We also have a disorder called ADHD. There are three subtypes, but we care about the inattentive type. Um, Inattentive type basically have 9 symptoms. You only need 5 of the 9. Let me explain to you what's the inattentive symptoms. The first one is called poor attention to details. So some of the details are often missed or making careless mistakes. E for being easily distracted. What distract people? Noise, movement, or their own daydreaming. Task avoidance. Tasks that require sustained attention. Not listening when spoken to directly, so I can't focus because my mind's somewhere else. Losing things, so people tell me they lose their bank cards, their phones, their keys, their wallet all the time. Difficulty sustaining attention, so I could focus for 10-15 minutes and then after that I'm gone. Disorganization, so my room is a bit of a mess, my desk is a mess, is my car is a bit of a mess. Then short-term memory problem, I forget appointment, I forget uh, you know, to pay my bills sometimes, or any kind of forgetfulness. And finishing tasks, so I could start lots of tasks, lots of reports are started, but it's not finished. So how many I need out of those 9 symptoms? I only need 5 out of the 9 symptoms. So those would be the uh, uh, what we call symptoms of inattention. There are To diagnose ADHD, we have to have those 5 symptoms often and very often. We also need to have some symptoms before age 12. So some struggle in elementary school, and 2 settings. So it can't be just at work or only at home. It has to be at home and work, or school and home. This is a very common disorder. A lot of us, if the delivery, for example, when we were born, had some complication or cord around the neck, or it was a complicated delivery, this lack of oxygen to the brain in the first few hours of life produces this type of symptoms very commonly. Now, I am going to move to the second category, which is personality problems. So this is, so far we talked about the common mental health issues. Uh, uh, those are what we call axis 1 disorders. Then let me explain to you axis 2 disorders. Before we talk about that, we have a normal development of human being where you see the self has a very thin wall. Others and the world outside is here. Myself is in. There is a thin wall that I can see others, others can see me. People with narcissistic and antisocial personality disorder, they have a very thick wall around them, so they can't see anyone else, no one else can see them. They can only see themselves. They talk about something called mirroring function. So when we are children, the parents tell us, oh, you are wonderful, you are great. So my parent is my mirror who gives me this mirroring function, telling me I'm good, I'm wonderful. Some kids never had this mirroring function. Their parents were not invested in them, and this was not, you know, a common thing that happened to them. They became their own mirror. So now instead they can only look at themselves, they can't look at anything else. And that's where the development of narcissism and antisocial. Some people have very, the boundaries are gone, and so there's no clear boundaries on themselves or others, so others could be in, they could be out. So that's called borderline and histrionic kind of personality. The characteristic of this borderline personality is very important. So this is a difficult kind of issue. Happens a lot when people are sexually abused, for example, at a young age, or physically abused. So the first criteria is efforts to avoid real or imagined abandonment. So I'm always scared that my partner is going to leave me or I'm going to be abandoned. Difficulty keeping friendship or relationships. Identity disturbance. I'm not sure who I am. I want to change my career, my morals, my values, my impulsivity, doing impulsive things like in spending money, sex, substance use, reckless driving, binge eating. Recurrent suicidal behavior. Here it's not I want to die. No, it's just I cut, I overdose, I just want to feel the pain. Mood swings within the same day, so within hours. 1 hour I'm happy, 2 hours later I'm depressed and sad. Feelings of emptiness, anger issues, and feeling paranoid that people hate me, talk about me behind my back. I don't feel good. So those are called, this is called the borderline personality. This is a major health issue, and treatment is very good, but it's just the problem is that people don't recognize that they have this disorder, and it's you need 5 out of 9 symptoms for that disorder. The next topic I want to talk about are the stages of change. So there are 4 stages to make a change. One is pre-contemplation, where I don't feel, any need for anything. I'm not there. Contemplation, I'm aware that there is a problem and I need to make a change. Preparation, I'm start feeling the problem and deciding about what I'm going to do about it. And then I actually make the change and maintain the change after that. So those would be the stages of change. Okay. So the first piece of wellness include recognizing if there's any of these disorders, and if I am struggling in any of these areas, trying and I need to fix some of these issues. The second piece of wellness is improving my day-to-day productivity to feel better about my own productivity and my own work. How do I do that? Basically, the first technique is time management. So understanding how many hours I'm spending working, spending my family, social time, trying to prioritize my need to organize, prioritize, scheduling, goal setting, and overcoming procrastination. Those are very critical skills I need to use. The organization include physical organization skills, so making sure that my desk is clean and neat, and mental organization skills, where this is way more important, where I feel you know, it's not so many thoughts coming at once. No, I have a place where I think about work. There's compartments for every piece, and I'm organized in these compartments. So the mental organization, and if I'm mentally organized, I could probably become more physically organized. The prioritization and planning is a very interesting part. They did this research more than once, repeatedly, and they looked at tasks that are important and urgent, important but not urgent, urgent but not important, and task quadrant 4 is not urgent and not important. Interestingly enough, this is where immediate action is needed. Quadrant 2 requires attention, but it's not critical. Quadrant 3 is nice to do, it's not important. Quadrant 4, these activities are the time wasters. And guess what time most people spend in these activities? We spend about 75% of our time in this quadrant, which is like unnecessary emails, other activities like that, not urgent and not important. So we really need to shift from quadrant 4 to quadrant 1. Prioritize quadrant 1 and 2, decrease or delegate quadrant 3, ignore quadrant 4. Use a calendar, record use scheduling apps. Very important to set goals, career goals, social goals, academic goals, family goals. Goals should be SMART, which is specific, measurable, action-oriented, realistic, and time-limited. To achieve these goals, you need to write it down, identify barriers in achieving it, break down the goals into small milestones, set deadlines for each of the milestones. Very important to build in accountability, so a colleague, a partner, and then evaluate your progress regularly, revise your plans as needed. Okay, so this is a very simple step ways of goal achievement. Now let's talk about procrastination. Why do we procrastinate? Sometimes to reduce an anxiety, sometimes because we have this, we want to get things perfect, but to be able to do that, sometimes we don't finish the task because we keep doing it over and over again. Sometimes we are not aware that we are procrastinating. Sometimes we are overconfident that we'll finish the task, but we don't. And sometimes we have a false belief that the procrastination is helpful. So strategies against and procrastination, anti-procrastination strategies. Number one is to forgive yourself for procrastinating in the past. The second one, promise yourself a reward. So if you complete a difficult task, reward yourself with a treat, a cake, a coffee, whatever. Ask someone to check up on you. Peer pressure can be helpful. if someone you trust. Act as you go. So tackle tasks as soon as they arise rather than letting them build up over another day. Minimize distraction. Turn off your email, social media. Social media is extremely distracting. Aim to finish the most unpleasant tasks first. So this will give you the rest of the day to concentrate on work that you find more enjoyable. If you are procrastinating because you find the task unpleasant, try to focus on long-term benefits of completing the task. Or another way to look at it is the unpleasant consequences of avoiding it. So what will happen if I don't complete that work? How is that going to help? What's going to happen? There's going to be people annoying me about completing it over and over and over again. So those are really important. Okay. I think the next section is different. So I need to really stop here and review this, take question before we move on to the next section. So I hope I'm gonna review what we talked about in terms of mental disorder. We talked about burnout and stress, the categories of burnout and stress, exhaustion, detachment, sense of ineffectiveness. Talked about the effects of stress, the adjustment disorder, the anxiety, most common disorder, generalized anxiety disorder. Talked about PTSD, post-traumatic stress disorder. Talked about depression, it's called major depressive disorder. Talked about ADHD, the inattentive type. Talked about the personality disorder, the borderline personality disorder. Stages of change. Then we talked about the productivity, but through time management, organization, prioritization, scheduling, goal setting. Talked about organizational skills, mental and physical. We need to focus on quadrant 1, ignore quadrant 4. We're going to schedule tasks. We're going to have career goals, work goals, social goals, academic goals, family goals. Our goals will be specific, measurables, action-oriented, realistic, time-limited. We are going to write the goals down, identify barriers, break down the goal into milestones, set deadlines, build in accountability, and evaluate our progress. So now we talked about procrastination, why we do it, and then the anti-procrastination strategies to promise yourself a reward, to forgive yourself, to ask someone to check on you, to act as you go, minimize distraction, start with unpleasant activities first. So now I think it is time for discussion and question before we move on to the next section. So I would love to hear any comments or any discussion issues. Would be wonderful. And feel free to unmute yourself or also, put your camera on. Any questions? Do you normally see anyone with an anxiety? Do you normally see anyone with depression, as those are things that happens in your community?
Good afternoon, Dr. Sadek. This is Justice Loban Jackson.
Hello.
Hello, thank you for your very comprehensive presentation so far. But I just wanted to address the elephant in the room. I don't know if you want to call it an elephant or a block of ice, and then you'd need someone to break the ice. The elephant in the room is that even though we're seeing an increase in mental illnesses in subtle and not so subtle forms in this region and across the world, it is still not something that is talked about or discussed openly. There's still taboo, there's still a stigma, there's still shame. So if you hear a lot of silence, it's not that we're not aware that it exists or understand various aspects of it. It's just that we're not used to discussing it as openly, especially if it affects yourself, a family member, people who you know in the community, because it's a very small community. And it is not as comfortable a discussion as you would have perhaps in North America. So just to let you know, the silence is not that we aren't listening and understanding, but the comfortable discussion is not yet part of our culture.
Thank you so much for saying that. I am you make me feel good that it's not it's not so boring, I hope. But I am very aware that this is not a comfortable discussion, but I think that and despite having a small community and I think that part of us being human means that we get ill, and the part of being ill is that we could have some of these disorders. So this is completely normal part of being human, is to be the same as we become diabetic, we have heart disease, we have all kinds of other, cardiac issues, medical issues. These, brain issues are very similar, very similar. And so I think that it's about time that we take that position, because it's just being human. So I really truly appreciate your kind comment. Anyone else has any comments? Out of these disorders, which one you think is most important? For your day-to-day kind of activity? Would you say burnout and stress?
I think burnout and stress is more common than we realize because the profession is so demanding, both for lawyers and judges. So burnout would be very common, but I think the most dangerous of all the disorders probably would be depression because of the consequences that it can lead to.
Yeah. We had 2 judges who died by suicide here. So this is not a foreign concept, just to let you know.
Right. Good afternoon, Dr. Sadek. If you could
Yep.
identify some strategies for dealing or interacting with someone who's suffering or maybe suffering with narcissistic personality disorder.
Would you mind repeating the question?
If you can highlight some strategies for interacting with or dealing with someone who may be suffering from narcissistic personality disorder.
Oh, that is a great question. What do you do interacting with someone with narcissistic personality disorder? So this is difficult because sometimes people with narcissistic personality disorders are in high places and they could be dangerous. So you have to be careful there. And in general, a lot of narcissistic personality, for example, marry a dependent personality, a wife who has dependent personality, and they get what we call narcissistic supply from that or from others. So the narcissistic person always needs this: you are great, you are wonderful. You know, he wants to hear how good he is all the time. And so providing this continuous narcissistic supply is not helpful to the person. So I think the first thing to deal with narcissistic person is to be careful. Number two, to understand that narcissistic people take advantage of others. So make sure you don't, so they very well know how to take advantage of people, ask for favors, ask you to do things, but they never give anything back. So it's very, you know, it's a one-way kind of taking. They know how to take very well. And so you want to protect yourself from that, and you don't want to supply them with this narcissism. The ideal treatment you see, narcissism underneath has a very low self-esteem, and so the person is actually feeling very weak, and so it's there's some degree of internal weakness there. The healthy person recovery from narcissism happens through therapy. And so depending on your relationship with that person, you could, point out to them that, mm, people are worried about these issues, or some of the therapy is actually very effective in narcissism, but getting them to therapy is really difficult. So it's not an easy process.
Thank you.
You're welcome. Any comments about PTSD? Are you guys seeing a lot of do you see a lot of like traumatic stuff through the court, or through any graphic details of kids being killed, or graphic kind of pictures, or those can very much produce PTSD, repeated exposure to those? What are your thoughts on this on PTSD in general?
Hi, good afternoon, Dr. Sadek. Thank you so
Hi.
much for your presentation so far. This is Resident Magistrate Salva Gardner. I hadn't considered that the work that we do on occasion can lead to PTSD in this sense. So thank you for kind of bringing that up to the fore, because we do, especially, at least in my experience, we're dealing with a lot of families that are broken, and broken in so many ways that it does have an effect on me sometimes, where I'm literally having to leave the bench to kind of compose my thoughts, and then return to hearing the traumatic events that occur, particularly with children. I think that's, if I had to say that anything affects me physically, where I'm having to leave the room, it's often with where children are involved. But I'd not consider that it could lead to PTSD. And I will confess that it's probably not unaddressed so far. But yeah.
Thank you. Yeah, I mean, we could be living with a lot of things and we're not recognizing what we're living with, right? So we could be feeling like tired a lot, or we could be avoiding some places, or we could be not sleeping well at night, or we could have all kinds of issues, and we're not really, recognizing how much of a burden we are carrying, um, and we just keep going with it. Although it, we could get rid of it and have a much happier and healthier life. Any comments about procrastination or ADHD? What did you think of ADHD? We have a wave here in Canada. Um, Everybody thinks they have ADHD, and everybody wants a stimulant medication that treats ADHD. It's becoming a very, very popular thing, popular diagnosis. Any thoughts on procrastination or on ADHD? The inattentive type.
I think post-COVID, we're seeing more cases of ADHD in children. I think it's being dealt with quietly by parents on a case-by-case basis. I'm not sure. I think there is a push for an approach by the Ministry of Education. However, I'm not so sure how many of the population has been captured by that attempt. I think it's more common in adults than we know, but that adults are better at masking it, dealing with it, working around it. So I think it is more common both in adults and children than we do realize.
Yeah. ADHD is very common in adults and children, but it's also a lot of us were never diagnosed as kids, but we still, the inattentive symptoms continue from childhood on. And the treatment of ADHD has the best response in medicine. The actual response rate is about 90%. The medication is so effective. It's about 90% response rate. So it's amazing. We don't have any other disorder in medicine that has an 85, 90% response rate. So just to let you know, the all right. So now I'm gonna talk to you about an important issue, which is barriers to seeking support. The first barrier, I think, is lack of time. We don't have time to think about ourselves, take time to wonder, if there's anything wrong. The second barrier is stigma, which was just touched on now. Stigma is very real. It's all over the world, and it's a very real thing. It's actual, problem. There's another fear of lack of confidentiality. If I talk to someone, they are gonna, not gonna keep that. So here in Canada, if you ever talk, you lose your license forever. So it's not an option to say any word at all. Fear of privacy breach, access. This is a very common problem in Canada. Like myself, my wait list is about a year now. And so people can't access the service. There's also this concept of being identified as weak. So if I go seek help, it means that I'm weak, or I am feeling singled out, feeling that seeking help means I'm in trouble. Or when we were young, they used to tell us, you should be strong. You should be strong and you should, take it. Yeah. And there is also a culture of silence and isolation. Some people feel that self-care and self-compassion are selfish. So some people feel like if they care for themselves, it means that they are selfish. So they shouldn't have any time for themselves, shouldn't do anything positive for themselves. And this is wrong. This is completely wrong. Self-care is not selfish. And some people believe that their physical, mental, and emotional needs are not really important. So putting that in mind, those factors are quite big. They are 10 important barriers here to seeking support. And I think that, is there any issues? I think it's fair to say, well, I could seek support. Here are some specific strategies that I want to talk about for mental health. The first issue is self-care. We need to take care of ourselves. Self-care is not luxury. It's an investment, allows you to be more available to those who rely on you. So self-care means taking care of yourself. You hear it at the airplane safety, you are not any good to anyone else if you pass out. So you need to, you know, take care of yourself first. Not in a selfish way, but just to be able to help yourself and help others. That includes regular exercise, proper nutrition, having a doctor, regular medical checkups, reading healthy things, watching healthy things, keeping your mind, keeping your stress level low. All of this would be, strategies of self-care. The second piece is to actually look after your day-to-day, productivity, that you don't want to be spending all your time working because of disorganization or so time management, organization of the day, activities, setting priorities, planning ahead, delegating. And majority of us take our work home, and that's unfortunate. Try not to take your work home. Taking regular time off is very important. And not necessarily if you can't take a physical time off, if you don't have vacation, you used all your yearly vacation, take a mental vacation. So on a weekend, for example, don't think about work. Keep that whenever you get thoughts of doing or thinking about a problem at work or an issue at work, push it away. So you don't want to have this kind of a working nonstop, even you can take a mental break. And don't wait for a crisis to force it. So start planning your breaks. If you can't take those regular holidays, start planning mental breaks. The next item is very important, which is keeping our stress positive, which is using a support system. It is very critical to have a support system. Surround yourself with people that are good for you, a good friend, a mentor, a loving pet, and reach out to people that you trust to get support when you need it. This support system is critical. Let go of your guilt. And if you struggle with something like alcohol issues or substance issues or other problems that happened in the past, let go of the guilt so you can move forward. We feel highly responsible, we work compulsively, we feel guilt if we don't meet the the full responsibilities all the time. Self-acceptance and forgiveness is very, very helpful for mental wellness. And the final point is use relaxation techniques and humor. Relaxation techniques, meditation, and humor are very, very, very important and very helpful. So those are, simple strategies that I think would be helpful for everyone. I think I'm gonna stop here and take questions. I know it's the end of your day, so I thought I'd make this, to finish in a reasonable time. So, any questions or any comments? I'd really love to hear from everyone, really. Any comments, any questions, any?
It's Andrew Mitchell speaking. If you work with people and you consider that one or more of them, so this is a general question not being asked on behalf of a friend, and you consider that they are struggling mentally, what advice would you give to the person who is concerned about the well-being of one or other people? I mean, confronting somebody without wanting to over exaggerate the difficulties of this, confronting somebody who has bad odor is difficult enough. How do you deal with somebody that you're working with who looks on your view, and having listened carefully to your fantastic presentation and the boxes that you have identified, I can see some ticks in certain places, but how do you deal with that with those people?
So, for somebody to accept that type of advice, I need to have a really good relationship with. I need to really have, the person needs to know that I care about them, that I'm not there to judge them, I'm not there. So it might not be me who can approach that situation.
No,
But
because obviously, and forgive me coming across you, but obviously in the legal world, whether it be judges or lawyers, or interactions between judges and lawyers, I mean, the very nature of our professional relationships are that we do not know each other very well.
but there are other people who could be close to that person, who could maybe more equipped to give them that type of advice. And so, because maybe if I tell them that I feel, that they are depressed or they are unwell, they might take it personally and they feel that I'm criticizing them. But maybe there is I know of a good friend of them that if I talk to him and say, well, I think I'm concerned about your friend, and maybe you could talk to him. I think that he's depressed and I'm worried that he would even kill himself, or just he's unwell. He's tired all the time. I'm worried about him.
And all of that is very good, assuming that the relationship that you have is one where you know of the
Yeah,
person about who you are concerned, personal lives, but you may not.
that is true. That is true. That is true. And in this case, it's a very fine line you would be walking to try to help that individual, because it might backfire and they might feel attacked by your advice. And so if it can be, said softly, that through a conversation, that you have heard of these cases and this is what happened, and you know heard of someone who struggled with these type of symptoms, and I think I at one point I struggled with them myself, and maybe what do you think I should do for my friend that is struggling with these symptoms? And so sometimes I bring a scenario of a third person who struggled and run it by that person and see if they would pick up on it.
Thank you.
You're welcome. It's not easy by any means.
Good afternoon, Doctor. Again,
Hello.
I may echo and thank you for your very informative and eye-opening presentation. Considering when I looked at your biography and the training you have, I know, do you have any strategies or perhaps coping mechanisms for when we judges deal with people or perhaps colleagues whose behavior negatively impacts our mental health, particularly in light of the unique pressures that we have as judicial officers? So in the myriad of things you've suggested, has your research or has your training shown particular things that are like a hierarchy of usefulness then, so to speak?
Of dealing with
Coping with the how things impact your mental health. So sometimes in the work we do, as Ms. Salvagarda describes, litigants, sometimes in your interactions, right, at your office where you work, you have things that affect negatively your mental health, how you feel about yourself, how you feel about your performance, how you feel about your value even. So are there any particularly hierarchy of things where you can help to cope, strategies that are, some work better than others, can you say?
Okay, so the one thing that we know that works is confronting the automatic thoughts. So automatic thoughts are a very powerful, very powerful issue that happens to all human beings. We all have automatic thoughts. Let me give you examples of, there are, like, they identified 10 major automatic thoughts that happens to all of us, okay? All or none. So I failed one exam, I feel like I'm a failure. Jumping to conclusion. Mental filter. So there is a problem and I focus on that problem, filter everything positive and just keep that problem. So all of these issues that that automatic thoughts, so I need to really get to my own automatic thoughts and then challenge these automatic thoughts, replace it by another theory. So for example, let me give you this common example. Somebody I walked by in the morning and they didn't smile at me and didn't say good morning. And I feel that this person that really wouldn't like me. I'm feeling bad. I'm starting to feel very negative for the day. This is my automatic thoughts. I'm going to replace that by thinking that, oh, maybe that person had a fight with his wife this morning, and that's why he's so unhappy and he didn't smile at me, he didn't talk to me. Now I examine my feelings after this second theory, kind of, and I will find that I'm feeling a lot better through that type of explanation. So challenging the automatic thoughts is very helpful. So number one, I need to identify the automatic thoughts, write it down, and put the theory, why this is happening, and then put other possibilities or other, theories that could be and that is called the CBT, cognitive behavioral therapy. That's where I change I challenge my own automatic thoughts. This has the most evidence, which is called CBT. And you can do your own. There is a book that's, I think it's available online for free, by Dr. David Burns. It's called Feeling Good. I highly, highly suggest that everyone should have this book. It's an old book, but it's still very valid and valuable. Feeling Good. All of this book is about challenging the automatic thoughts. Feel good. It's a beautiful kind of concept. So those are really kind of important. I think that also having a qualified person that we can talk to is very, very helpful. So sometimes I get, judges from different places in Canada talking to me, and then I don't say anything. And then at the end of the talks, they say, "Oh, well, we feel great," because they just were able to talk. They just, they had an outlet that is safe, and sometimes I don't say any word. I just keep listening. So sometimes having that outlet can be extremely helpful, that I'm able to talk about very private things, very difficult things, very disturbing things sometimes, and I just have an outlet. I was able to talk about it. Sometimes just getting it out give me such a relief. Does that make
So,
any sense?
so then, doctor, our thoughts, so you're saying, or said, well, you're saying that our thoughts, let me see how to put this. Our thoughts then influence how we feel and how we behave. So that these distortions come about by, you're saying, overgeneralization and thinking negatively. So you need to reframe the negativity into something more rational then.
Absolutely. Yeah. There is all kinds of evidence that supports that. Because our brain has we have this automatic thoughts coming to every one of us. I'm glad you talked about overgeneralization. This is an actual description of one of the automatic thoughts. I'm very impressed, because this is exactly one of them. All of us have those thoughts, and just confronting those thoughts, picking them up and trying to change them has a huge evidence.
Thank you. Thank you so much. Thank you so much, doctor. Thank you.
You're welcome.
Good afternoon, doctor. Thank you. You've mentioned the rise in diagnosis for ADHD and the success in the medication or the treatment of it. Have you seen any long-term side effects of the medication, and are there any alternatives to treatment with medication? Thank you.
Wow, that is an amazing question. As a matter of fact, I was giving a lecture yesterday. Today is Friday. On Wednesday, to McGill University in Canada, about long-term effects of ADHD medications. This was my talk, actually. So I'm glad you asked that. So the funny thing is, Most people who start ADHD medication, unfortunately, don't continue to take it. So most of the studies that were done discovered that in 6 years, people who started ADHD medication that should be continued on it, only 50% of them are continuing to take it. So 50% of people don't take the medication. And so the idea that there is a long-term treatment, it actually doesn't really happen. Okay. The long-term issues are very much that there is no cumulative effects of the side effects. So the side effects do not accumulate. The side effects are numerous. So one of the worrisome side effects are in 5 points increase in blood pressure and heart rate. Sometimes difficulty sleeping at night. In kids, and we worry about weight loss. So there is some degree of weight, appetite suppression and weight loss. But in adults, everybody loves the ADHD medication because they lose weight on it. And it's actually also Vyvanse is used in binge eating disorder. So people who struggle with eating bigger quantities, they no longer want to see the food anymore. So in kids it's a problem, the weight loss and the appetite suppression is a problem. In adults it's not. Sleeping is can be a problem, but people take melatonin, which is over-the-counter herb, and it's wonderful with ADHD medication. It restores back the sleep, so that's not a problem. The 5 points of increase in blood pressure and the heart rate, if there is a heart problem to start with, we can't give ADHD medication, period. But if you start ADHD medication and then you get 5 points increase in blood pressure or more, depending on your original blood pressure, if it's we could switch to something else, we could add an antihypertensive, or we could stop the ADHD medication. But the cardiovascular issues are the most kind of relevant issue. There is people who have seizure disorder. ADHD medication could make them have a second seizure. People who have tics the tic level could increase again. So but in general, it's very well tolerated. There is an article in it's the New York Times, and they talked about why people are allowed to have cosmetic surgery and not allowed to have cosmetic cognition. So in a way, people are allowed to have a cosmetic surgery, improves their shape, improves their face, do all kinds of cosmetic surgeries, right? So the article is saying, well, if that is the case, why can't I improve also my cognition, my ability to remember things, my ability to increase my productivity through taking ADHD medication? And a lot of university students buy it like from drug dealers, unfortunately. And the simple answer is that it's not ethical to give medication when there's no disease because of the side effects. But it's an ongoing kind of discussion. So
Thank you very much.
you're welcome. happy to hear more comments. And like, I really wanted to spend time in discussion and you know, I thought that would be more important and more helpful than just me talking, you know. Of course, I wish this was in person. I would have been in a nice weather with you guys, but next time, hopefully. Any comments? And thanks very much for the Chief Justice for inviting me. Hoping to hear your comments about procrastination issues. Because I hear that, you know, producing judgments can take time and or some of the issues in court can be difficult. No comments, no further comments?
So we'd like to open the floor for any final comments or questions for Dr. Sadek. It doesn't seem that there are any further questions, Dr. Sadek. You've been very comprehensive and thorough and very helpful.
Thank you.
And if that's the case, then I'd like to invite Ms. Tanya Carter to give the vote of thanks for this session. Please be reminded that immediately following the vote of thanks, we'll be having the formal closing ceremony for JI Week 2024. So I now hand over to Ms. Tanya Carter, the Executive Director of the Office of the Chief Justice. Ms. Carter. Ms. Carter. Hi, good afternoon, Dr. Sadek.
Hi,
I've been asked to do the vote of thanks.
I can't hear you, sorry.
Apologies. I've been asked to do the vote of thanks for this session. So on behalf of the Judicial Education Institute, I'd like to thank you very much for this informative presentation on continuing mental wellness. You've given us all a lot to think about, and you've given us a lot of tips and strategies for dealing with our mental well-being going forward. I'm sure that we're all going to use the tools that you've taught us today going forward as we continue in the profession. So I would like to thank you, and we hope that you would join us again, because every time you do come and you do join us, we learn so much more about strengthening our mental well-being. So thank you very much on behalf of the Judicial Education Institute of the Turks and Caicos Islands.
It's my great pleasure. Thank you very much. And thanks for inviting me. Thanks everyone here, and thanks to Chief Justice Mabel. Thank you very much.
So thank you very much. This brings the session on mental wellness to a close. Thank you, and please stay on as we will begin the formal closing ceremony in just about 1 minute. Thanks very much.